Excuse me. Good afternoon. Today is October the 12th, 2022, and it is 1 o'clock exactly. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. The first item of business is public communication. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yesenia, did anyone register to make comments for the Strategic Planning Committee meeting?
No, Chairwoman, nobody signed up to make public comment today.
Thank you. We will now proceed to the committee agenda. Number 1, review and approve the minutes of the July 27th, 2022 meeting of the Strategic Planning Committee. Ms. Manager Valdez.
I move that the committee approve the minutes of the July 27th, 2022 meeting of the Strategic Planning. One more time. I move that the committee approve the minutes of the July 27th, 2022 meeting of the Strategic Planning Committee.
And do I hear a second? Okay. Manager Musaitov has seconded, and so votes. Anyone for? Any against? Did he say yes?
I'm sorry.
Yes.
Yes.
Okay. Yes. All right. So all members present have voted yes to accept the meeting minutes. Okay. Number 2, discuss the next phase of Central Health's ongoing equity-based systems planning work and operational and financial sustainability planning, which will include developing plans to implement the board-adopted healthcare equity plan. Ms. Crowley will be presenting along with Dr. Sharma, Danielle Srinivasan, and Julie Clark from Guidehouse. And we're thrilled to have Guidehouse working with us again. Thank you.
Thank you, Managers Monica Crowley, Central Health, and I am really just excited to be kicking off this work here with Danielle and the team from Guidehouse, and I'm going to let Danielle introduce herself. I'm not sure if anyone else is on the line or if Danielle is taking the presentation today. So thank you, Danielle.
Thank you, Monica. And thank you very much to the Central Health Board of Managers and leadership for having Guidehouse return with this critically important work. So on behalf of Guidehouse, thank you very much. What I'd like to do today is, if we could just jump to the next slide, please, is just talk about what we're going to cover. So I'd like to introduce you to the team, talk about the work that we've completed to date. So that phase 1 work that is really serving as the foundation for the work we're about to embark on together. Number 3 is to talk about this phase of work. So what is it that we are going to accomplish together, and then just go through next steps. So again, my name is Danielle Srinivasan. I had the pleasure of working with each of you last year on the phase 1 work, which was the development of the equity-focused service delivery strategic plan. And Dr. Avi Sharma, who also worked on that with you, is also involved in this next phase of work. We are so committed and dedicated to this effort, and we felt as though it was critically important that we both be involved to serve as the foundation as that work carries forward. With that said, we've brought together a very large multidisciplinary team that consists of experts across all disciplines, so administrative, clinical, as well as some local hub businesses, to really make sure that we are capturing the essence of those that are underserved and most vulnerable within Travis County. So I'd like to introduce you to one of my team members today. Her name is Julia Clark. Just so that you can get to know her today, she will be a familiar face for our work that's to come together. Julia, did you want to take a moment to introduce yourself?
Absolutely. Can you all hear and see me?
Yes.
Perfect. So I'm Julia Clark. As Danielle mentioned, I'm a director at Guidehouse. I work in our strategy and innovation practice. By background, I have a doctorate in public health. And so my area of expertise and passion is in population health, in particular serving underserved communities. So I'm just incredibly grateful to have the opportunity to work with you all. This is incredibly important work. There's a ton to do, and we're just really grateful that we're able to serve you all.
Thank you, Julia. So with that said, I'd like to just review some of the work that's been completed to date, because that really is the foundation of what we're going to build upon over the next, say, 10 months together. So if we can jump to the next slide, please, and I believe it's the slide after that. Thank you. So when we think about the vision of Central Health and what we're trying to achieve here, it's really the development of that high-functioning system of care. So what does that mean for those that are underserved, vulnerable, the patients that Central Health really is trying to reach? So it's not only just ambulatory. When we think about some of our ambulatory partners, it's the hospital care, it's the post-acute piece. It's really assuring that we have access to critical specialty services, since we know so many of those that we serve have chronic conditions that take a very complex approach to really drive outcomes. When we think about really improving health, we know that it's not just a visit to sit to a specialist or a primary care physician that's going to solve their conditions. We know that we need to anchor ourselves with care management, care coordination, with meaningful data in a timely way, so that we can really help these patients live healthier lives and really improve the quality of their life. So when we think about this whole system of care approach and the delivery system that we envision for our patients, it's really that high functioning delivery system that touches every facet of healthcare. Next slide, please. So what have we done already that we're looking to build upon? So when we think about the needs of those of the safety net in Travis County, we've done a very deep dive to really understand at a starting point what those needs look like. So phase one, we really did a lot of data-driven analytics to really inform ourselves at the most local levels. What are some of those healthcare needs? Because we know that so many of those that are vulnerable and underserved are really challenged with daily resources. So for example, transportation, housing, food security, all factors that impact overall health and their ability to seek care. So when we looked at the community needs assessment, we got as granular as we possibly could at the census tract level to understand what those local needs are, because we know that needs change across the 14 planning and assessment regions that comprise Travis County. We looked at Central Health's capabilities and performed a gap assessment. So how do we stand today, and how well prepared are we today to serve those needs? And gaps are not bad. Gaps are opportunities for us to really reposition ourselves when we think about that high-performing delivery system, so that we can really extend our reach and impact to those that are vulnerable and underserved. And then really listening. So the voice of the community was that qualitative piece that connects everything together. So really understanding stories of those that live this every day, understanding their daily challenges, understanding how we can be more culturally competent in our healthcare delivery models, and really understanding what are those factors that influence and impact how they seek care, and if they're able to receive care at all. All of those elements were combined to develop Central Health's service delivery strategic plan. So that strategic plan with an equity focus. So making healthcare equitable as part of our future vision through this work. Next slide, please. So as I had mentioned earlier, when we looked at Travis County overall, we divided Travis County into 14 planning and assessment regions. And the reason why we did that was to really understand what those local healthcare needs are so that we can really customize and develop a healthcare model that makes sense for these patients. So how do we reach the underserved and most vulnerable, and what is the model that's going to work for them, given our available resources and capacity? So when we looked at that, we really took into consideration transportation, travel patterns, population density, and really kind of looking at that neighborhood level to understand what are the factors that influence access and what are those models of care look like for the future. Next slide, please. So what did we find from the phase 1 community health needs assessment? We found that the social diversity of Central Health's patients is going to require a culturally competent approach to really drive change to improve the health of those that are underserved and most vulnerable. That approach will be anchored by data so that we have timely data to make decisions that will improve the health of those that we serve. We know that the reliance on providers today is not sufficient, and that there is very limited access to both primary care physicians, as evidenced by a large shortage of primary care providers in the community today, as well as those of specialties. So when we think about the patients that are served through Central Health, those that are most vulnerable, safety net, complex medical conditions that require care coordination, we know that there are some opportunities to really develop a system that can meet their needs. This system needs to be anchored by appropriate staffing and data so that we can really drive change for these patients in their health. Okay. Next slide, please. This slide is, this was also a repeat from our phase 1, but really just summarizes our key findings from the community health needs assessment. So overall, we found shortages in primary care, specialty, and then hospital-based and post-acute services for those vulnerable populations and those of the safety net. So what does that really mean? So for primary care, it's timely access so that patients are not sitting in a clinic all day, missing work. How can they make an appointment and be seen in a timely way when they need it? So it's that right care at the right place in the right time. Wellness and prevention. So not just triaging patients with an ambulatory sensitive condition, but really driving wellness. How do we help them have healthy lifestyles? So the health education, really managing chronic conditions, and really anchoring population health as the center of this. And then urgent and convenient care. So rather than using the emergency department as an after-hours service, how do we extend urgent care, which is a lower cost to the system overall, And also ease of access, right? Easier to access for our patients that are already challenged to access services today. How do we make that more available to them today? When we think about specialty care is so important because we know that the chronic conditions that those that we serve are so prominent. How do we expand access to specialties and then also coordinate that care for those that have chronic conditions? Behavioral health also was cited as a large need. We know that a lot of those that we serve have comorbidities, so behavioral health and medical needs that really require a thoughtful, clinically focused approach to drive health and wellness. And then dental as well. So dental was also cited as a significant need. And when we look at dental also impacts medical health. When we think about our hospital-based services, it's really assuring that our patients are able to get the access that they need so that they're not being admitted on an emergent basis with an emergency, but that they're able to get the care that they need going back to the right place at the right time. And then post-acute, so thinking about respite care and other post-acute offerings so that our patients are not sitting in the hospital when they could be discharged to a more comfortable setting when they do not require acute levels of care. Next slide, please. When we think about the clinical needs of those that are underserved, safety net, most vulnerable across Travis County, a significant degree of investment is going to be required to really meet those needs. So thinking today, based on our current capacity, physician salaries alone equate to approximately $21 million annually. And that does not include the wraparound services and staffing that are really required to stand up a sustainable, sufficient practice where we're meeting all of the patient needs, right? So we think about administrative support and medical assistance and all of the triage. So all of those services and resources that are really necessary, nurses, so that our patients are really receiving the services that they need. When we think about increasing our capacity to meet even 70% of the need, those salaries go up to about $62 million annually. So we know that the need for those that are underserved and most vulnerable in Travis County is significant. And the staffing shortages for physicians is also significant. Next slide, please. So to close the gaps, through our work last year, Central Health developed 4 system-based strategic imperatives to really drive impact through the equity-focused service delivery strategic plan. So those 4 imperatives touch on access and capacity, care coordination, member engagement, and system of care. And what I'd like to do is just touch on each of these briefly for a moment. So access and capacity is really assuring that we have the right access at the right time in the right setting, and really understanding through our work looking at the different geographies within Travis County what those needs are, because the needs are going to vary across each area. When we think about care coordination, how do we assure that our patients know how to access the system, that the care is coordinated so that they're receiving the timely follow-up care, and that those multiple chronic conditions are being managed effectively. Member engagement. So how do we engage with our members? So this is a multifaceted approach where we know that our members are, that it's a 6-month time period, and we want to make sure that they know that they must re-enroll, so there's no lapse in their eligibility. And then further, how do we expand our reach to some of those hard to reach enrollees that we have not reached today? We know that Central Health, there's a real opportunity for Central Health to extend its reach to hard to reach enrollees, and there's a real opportunity to do that through this work effort. And then a system of care. So how do we operate as a coordinated system of care so that care is effective, it's timely, and we're aligned across our providers and our partner organizations? Each of these 4 strategic imperatives will be anchored by access to clinical staff. So do we have enough staff? That impacts our capacity. Do we have the right administrative staff? So to really kind of lead the charge and provide the support services for our clinicians. Our IT systems and data capabilities are paramount. So really having that data and IT linkages with our providers so that information is shared timely, it is accurate, and it's meaningful as part of the care that these patients receive. Our contracts and agreements must be aligned, and we must have the right infrastructure to support these efforts. Next slide, please. So through this work, what we will do is prioritize strategic initiatives to really drive this high-functioning delivery system for those that are underserved, vulnerable, safety net. And through this work, what we will do is prioritize these initiatives based on impact and complexity. So degree of impact means that so we will measure the degree of impact. And what this does not mean is that for some initiatives, there may be less impact, easier to implement. So less complexity and will require less resources. Other initiatives may be incredibly impactful, perhaps cover the entire geography, but also very complex, will require significant resources over a longer period of time. So the messaging here is that as your partners, we will guide you through this process. We will help you make meaningful, data-driven decisions so that as we prioritize initiatives, you will understand the degree of impact and the amount of resources that will be required as we look to make change. Next slide, please. So the work that we've just reviewed together has brought us together today to talk about the operational and financial sustainability planning effort, which we consider to be the second phase of this work, building upon the foundation that we've already built together. So next phase, please. Next slide. Thank you. So just as a recap here, we have the high functioning delivery system structure that what we're really trying to do is build this high functioning, high performing delivery system for the safety net community so that we can improve the health of the most vulnerable and underserved. What we do know is that it's going to require significant change in infrastructure and a commitment to this. Next slide, please. So what this slide does here on slide 29, for those of you that are virtual, is this slide just outlines the process of how we execute in our vision to develop that high-functioning, high-performing delivery system for those that are most underserved. So we've already developed our vision. So our vision is very big and bold. So when we think about that, now we have to think through the governance. So do we have the right staffing to really drive this forward? Then we think through the financials and the operations. What is the operational structure and the funding mechanisms that are going to be necessary to execute on this vision? When we think about clinical excellence, it's making sure that we have those right services at the right time in the right setting for those that we serve. And then thinking about the integration. So how do we activate this work? How do we activate this system? And then make sure that we are operating at the absolute best level. Next slide, please. So really here on slide 30, we've taken the equity-focused service delivery strategic plan, and now we are deploying and designing. So it's really developing the operational plan. So how do we implement? And then understanding the financial piece. What does the financial performance look like based upon what we design and intend to deploy? Next slide, please. So I'm going to take a pause here. I'm going to hand this off to my colleague, Julia Clark, and she'll walk you through the detailed approach that we've designed with Central Health leaders for this next phase of work.
So team, we've heard a lot of information on kind of what happened and what was executed in phase one. We want to spend a little bit of time talking through the objectives of phase two and kind of exactly what that work is going to look like. Before we dive into each of the phases, were there any remaining questions?
There were no questions to be provided until you're through with the presentation.
Okay. So the objective of this phase of work, as we've heard from Danielle, is to ensure that there's an implementation of that service delivery strategic plan. And this will help to build and operate a financially sustainable, comprehensive, and high-functioning, equitable, and affordable safety net system for the patients of Travis County. And that work is laid out into three separate phases. The first phase is to take a deep dive into the needs of the community and truly define and prioritize what types of initiatives will be most beneficial and most impactful to the community. And then once we have that list of kind of prioritized initiatives, we'll look at the capabilities required to stand up these initiatives, the operational alignment and oversight models to execute on each of the initiatives. And then we'll design an operational roadmap that takes us from where we are to where we need to be to implement each of the initiatives, as well as the underlying financial plans to stand up all of the initiatives. Next slide, please. So within the work in phase two, there are 4 core tenets that are paramount to all of the work that we're doing. And that is, of course, access, equity, quality, and innovation. So all of the work that we are doing is designed to provide access to patients in Travis County based on the needs and the degrees of impact. We want to provide equitable care to every member of the community. And that will be things like looking at social determinants of health and how social determinants of health impact the accessibility and the need for care. And then quality, so ensuring that it's equitable and high quality care. And that's why those rings are concentric circles right there, because all of the work that we're doing is based on providing high quality, equitable care. And then looking at each of those initiatives, is there a way that we can provide more innovative solutions so that those hard to reach patients that Danielle referred to earlier and other patients in need that we've not been able to meet the needs of to date can receive care in a different way that might be more likely to help impact their career or their health trajectory. You can go ahead and slip to the next slide. Thank you. So within that phase one of the work, which is defining and prioritizing the initiatives, the objective is to develop that prioritized list that will then be staged and sequenced so that we can achieve the healthcare equity plan for the residents of Travis County. Within that phase of work, there are two key deliverables. The first is the community needs catalog. So taking a look at all of the information from phase one, a lot of data, and the needs of the community to develop a summarized list of needs that will include variables like the type, the scale, the location, scope, and the urgency of these specific needs. So that once we have this catalog, we can then move from that list of needs to the prioritized initiatives that will actually help meet those needs and achieve these equitable objectives. We can go ahead and slip to the next slide. Thank you. Then within phase two, the major objective here, as I mentioned, is to define those capabilities and then the operational alignment and oversight models that will be required to execute on each of the initiatives. The other thing that we'll do in this phase of work is ensure that we have a methodology to track and manage accountability. So as we decide on each of the initiatives and as we work through which initiatives make most sense for the population, we'll have a list of accountable parties as we're continuing to execute on those prioritized initiatives so that we can kind of track that accountability. Looking at the key deliverables for that phase of work, there will be 4. The first is architecture maps. And really that is a look at where we are now relative to what is the ideal state. So we'll map out an ideal state where we want to be as a high-performing organization that's able to serve all of the patients of Travis County in the way that they need to be served and in the right time. And then going from there, we'll build kind of what does the roadmap look like to bridge the gap between where we are and where we need to be. And that will be within that second deliverable, the capability maturity maps. So those are both at the initiative level and at the system level. And those will help look at where we are relative to where we need to be in terms of maturity, identify any of those gaps like Danielle mentioned on the previous slides, and then how are we going to fill those gaps to truly meet the needs of the community. The third deliverable is the oversight and operational alignment models. So once we have a list of those prioritized initiatives, this will be the underlying way that we'll deliver on the initiatives. Who are the major owners of the initiative? Who are the major doers of the initiatives? And how are we going to make sure that we can stand this up effectively? And then the final deliverable will be a reporting model and measure. And so that's really just key performance indicators to ensure that we're tracking at both the initiative and system level so that we know, have we been successful in mobilizing these initiatives? Are they going to be efficient and effective? And how are we going to continue to track to make sure that they are efficient and effective? Next slide, please. And then finally, in phase 3, this will be the design of the operational roadmaps earlier referred to, and then the underlying financial plans. So within the operational roadmaps, what we'll have is a list of all of the details for each of the prioritized initiatives at the initiative level and at the system level, which will be a detailed process for how are we going to get to each of these initiatives, how are they going to be built and implemented and stood up, and then what are the underlying financial needs of each of these initiatives, which is broken up into the bullets that you see below. So the financial plan will include financial modeling, it will include cost and expense assessment. It will include financial reporting, which will be at the system level, which are the standards and formats for reporting. It will include value analytics and measures. that will help us assess our opportunities, costs, any risks, et cetera, and then subsequent risk mitigation plans for any identified risks. And then budgetary models and structures. And those will be forecast modeling that will help use historical data to then predict our future results, capital planning, and then funding models. And within the funding models, we'll be using different opportunities to identify and evaluate sources of state and federal funding to help support implementation and design of these initiatives. Next slide, please. And what you see in front of you is the overall timeline. So this is the activities that will occur over the next 9 months and the distribution of the phases throughout those 9 months, as well as continuous engagement with yourselves. The diamond icons are the board meetings. So each of the times that you will hear from our teams to ensure that you're up to date on everything that's happening, can provide feedback, et cetera. And then what you see as the stars are the key deliverables that we just reviewed. You can go ahead and move to the next slide. So in terms of next steps, and these are our immediate next steps, we're working on the catalog of the community needs by the type, scale, location, scope, and the urgency of the needs. And then we're also looking at operational capacity needs to understand each of the needs within the organization, the existing capacity, the future needs for capacity, and then any operational limitations that might be present today. And then forthcoming is the December Strategic Planning Committee meeting, which we will present updates at as well. Next slide. And I think we're able to open for questions.
Thank you. Thank you so much for that presentation. I think it was excellent. Does anyone have any questions? Yes, Manager Valdez.
I do, but I didn't know if you wanted to go around, or
Oh, well,
does it make a difference? Like start with Shannon maybe.
you want to? Okay. So we're going to go around. So Manager Jones, do you have any questions or comments?
Well, this is a lot to take in a period of time, so I would like the opportunity to digest and perhaps have the opportunity to have follow-up. It was very detailed and very helpful. I guess, and this might be part of what you did in the first phase, but when we look at your mapping, I was very impressed with I think it was 14 regions you had identified. And within those regions over time, as the demographics and the epidemiology of the areas changes, what methods will be put in place to try and assess what's going on and evaluate the success of what intervention was in place or what changes are occurring? So I know it's not a question you can answer right quickly now, but I just want to emphasize that should be part of us doing that type of assessment as well. So.
Absolutely. So as part of this work in the implementation planning, so the roadmaps and the architectural maps that were referenced a little earlier, there's always a surveillance and monitoring recommendation to this, because we agree with you. We know that as the community evolves, and we know that this community has gone through quite a bit of change even up recently, that surveillance and monitoring is of critical importance, because we really need to make sure that we're using our resources well to really drive impact for the health of this community.
And given, just one last comment, and given the dynamic shifting of populations within the county over the last 20 years, in anticipation of the next 5 to 10 years, the question is, what will that look like? Will the needs of central health be the same in the same geographic areas as they are, as we're planning for? So those are the kinds of factors I think you want to consider. And I'm sure you will, but I just want to emphasize that we want to consider, because just within the last 2 years, we've seen a mass, I won't say mass, but we've seen a significant migration out of certain parts of of our targeted areas to other areas. And one question I just mentioned, what is the long term, how does it look for, let's say, 15 years from now? If the current rate of migration east occurs, a large number of the population that we serve may not be in Travis County anymore.
That's right.
And so then the question is, what happened to those populations because they've been priced out? I know we can't answer it now, but I'm just thinking we need to consider all those factors in terms of the evaluation.
We agree with you wholeheartedly. Part of our recommendations include an element of flexibility and adaptability. So it's going to be really important for our recommendations together to include elements of flexibility and adaptability to really be able to be nimble and adapt to those changes, whether it be up, right? So an increase in demand, or say a reduction in demand based on potential shifts out, right? Because we want to be able to optimize use of our resources, since we know that we have limited resources to really make a significant impact. So that'll also be a very critical element to all of this work.
And I do want to remind everyone that since February, we have continued to work on the updated demographic report. So Manager Jones, you remember that every 2 years we do a demographic report, and that is based on updated information. And we are sharing as part of this kickoff with Guidehouse even the updated demographic report that should be completed by Thanksgiving. So hopefully we'll be presenting that to you all in December. That is based on the 2021 ACS census estimate. So we will be capturing at least the past 2 years updates in this work. And then I think part of what is going to be really valuable from Guidehouse is coming up with a methodology that we can continue to use to take in those updates and apply it to our prioritization and the work that we're doing. So thank you. Those are great questions.
Thank you.
Thank you very much for the presentation. I remember when y'all were Navigant and now you're Guidehouse. But I'm the one that's going to ask about what we've done before so that we're not duplicating efforts, and that way we're managing our resources better. So in the past, we've spent millions of dollars on our IDS systems, okay? I personally would like to know whether or not that has been evaluated and whether or not there any recommendations have been incorporated into that. I also know that we have also been receiving lots of millions and millions of dollars for DSRIP. And the results of those DSRIP projects was to modify modify our protocols and our practices so that we wouldn't need to have DSRIP. DSRIP was made specifically for us to get results, change our system or modify our system, tweak it however we needed to, and then the patients and our communities would have the benefits of those results, what we learned. So if that has been done, I'd like to see how it has in fact been done, because I've asked that question to be answered and it hasn't been. Also, with respect to reaching our hard to reach populations, because that's an area that's very important to me, and I know to most people on this board, but especially to those of us that work in those communities and have worked for decades in those communities and not really seen a significant change at all. Whether or not y'all have considered looking at not necessarily building the capacity in-house, but rather continuing to look at those community-based organizations to see whether or not they can, since they know those communities well, they work, live, and play in those communities, and they speak that language, they know their needs, whether or not that is going to be a model that we will continue to use, as opposed to building up our central health staff at that level by bringing, people, I'm going to simple example, when we were talking about the Hancock building, I know Mike told us that they had done a study of their employees and that was centrally located based on where their employees lived. So, the Hancock building is the old Sears building right there on 38th and a half and I-35. Well, if you look at our targeted population, 200% FPL, and significant deserts at all levels, they don't necessarily reside there unless they were forced to live there. So when they talk about the corridor, east and west of the I-35 corridor, that's because that's where the city and the county put affordable housing. That's where they put their projects. So it was a specifically centered around 35 and East Austin and Runberg, close to the 35 corridor, specifically so that they could have accessibility to going downtown or going to wherever the existing clinics were at the time when we're talking about healthcare services. So that's not the case anymore as we look at going to where people are moving to and building apartments or homes in those areas. That will change, and it will change probably by the time we get up and going on the Hancock building. I would think that's like the Department of Transportation building a highway, and by the time it's finished, it's already 10 years out of date.
Manager Valdez.
I'm sorry.
Yes.
Well, and then the actual numbers of patients. We're talking about the patients that we're serving in basic and MAP and MAP basic. Where are they actually coming from? Where are they located? And what is what are their needs? Okay. And then the last thing for the next phase is this going to be a collaborative effort with working with the enterprise, all the enterprise members, community care, central health, and Sendero, to see how we can, as an enterprise, address the issues that are being raised and our failure to have implemented prior to this or created an equitable system. And one last one, will our staff, especially our leadership and management team, will they be working with the other governmental entities to look at a comprehensive plan to be developed, which is going to say, you're responsible for housing, you're responsible for education, you're responsible for the chambers of commerce, you're responsible for the development of the labor market and training for employees. So are we going to also include those kinds of initiatives in addressing the big picture and then taking it down to the bottom up? Thank you.
Thank you, Manager Valdez. I'm sure that's a big, you can't, answer all of those.
Oh, and I still have a lot more, but that's okay. I'll write it and send it.
Yes, I think that might be best for them to be able to answer so many diverse
But
questions.
there's some things that are key and core to the development of the plan.
Yeah, I mean, I think we can touch on some of these if you all would like us to. Otherwise, we're happy to just take notes and get back to you all. What's your preference?
Well, I'm one of those that's going to have to leave early today. So if you would look at the development of responses and get those to me, I would appreciate it. But I just want to know that they're going to be responded to, and that I would have an opportunity to get back with you on the other issues that I wanted to raise. Okay?
Thank you.
Thank you, Madam Chair.
Yes, and Manager or Chairman Bell and Manager Oversight.
Thank you, appreciate it. Thank you for this great presentation in this major undertaking. And I personally do not know how you will be able to do it all in this limited time frame, because you're just trying to really design a system from the ground up. You're very ambitious. I'm going to be caution the board. We're not going to have the solutions all at once. It's not going to be perfect. I think care coordination is a critical aspect of improving the quality of care of our underserved population. And that component by itself, it's a major undertake in terms of infrastructure, education, communication, and awareness to ease the transition of care, especially for our marginalized population. Even though the Institute of Medicine had a recommendation, more than a decade ago as a component to address this. And until today, we're still lacking. And central health is not unique to any other medical healthcare institution all across the states and the world. So it's an area that is lacking. So I just really wanted to make those points, and also to make my fellow board members aware. This is a massive, major undertaking, and we need to celebrate the small successes, even though it may not be perfect. And I congratulate you on this initiative, and I look forward to more details and I believe the next coming months are going to be very critical in terms of design. I think that's even more difficult than implementation by itself. So thank you.
Thank you. And is Manager Matwani still on? No, okay. All right, thank you so much.
Thank you.
Thank you, it was a wonderful presentation. Thank you.
I
Oh, you are, okay.
Chair Brinson, but I
Well, Manager, I think we missed that, but can you repeat that? Do you have any questions?
was just saying nothing to add.
Okay, thank you. Thank you so much.
Thank you all very much.
Thank you. So there is no motion necessary on number 2. And now number 3, receive an update on the creation of an opioid crisis response campaign for Travis County, led by Central Health in partnership with Travis County's District Attorney, and Austin Public Health. Ted Burton and Camila Rodriguez will be presenting. Thank you.
Hi, everybody. I'm Ted Burton, Vice President of Communications. Good to see everybody today. I'm here with my colleague, Camila Rodriguez, and she's our graphic designer, who I don't know if you've met the board in person before.
I don't think so. I've only seen them virtually. Hi, nice to meet y'all.
Meet Camila. She's one of our many very talented folks on the communications team. We're here to provide you with a brief update on the opioid overdose crisis response that's happening here in Travis County and frankly around the country. We are working with Austin Public Health, Travis County, the Travis County District Attorney's Office, and Integral Care on an initiative to address preventable overdoses here in our community. Just a little background. In 2021, there were 308 preventable overdoses in Travis County, and that was a 237% increase over the previous year. Just this last March, opioid overdose deaths doubled from 60 to 120, resulting in Travis County commissioners in May issuing a public health crisis declaration in Travis County. And then in June, the Austin City Council also unanimously passed a resolution declaring drug overdoses a public health crisis in our community. So we reached out to Travis County and Austin Public Health, as we did during the COVID-19 crisis, and offered our support to help them develop a unified message and branding campaign to address this initiative. And we've been working on that now for a couple of months. If you remember, during COVID, we developed the Let's Stick Together initiative in partnership and collaboration with Travis County and Austin Public Health, and we're doing the same thing now with this opioid crisis. I'm going to turn over to Camila to talk a little bit about the goals and the target audiences that we're trying to reach, then I'll come back and tell you about next steps. Camila.
Yeah, thank you. As Ted mentioned, I'm the graphic designer with the communications team. We're working with our vendor Belmont to create a cohesive brand campaign. The main goal of this whole campaign is to prevent deaths by reducing opioid overdoses around Travis County. We are focused on creating awareness of the crisis, educating the community of the dangers of the opioids, and understand how to talk with kids about the opioid crisis going on. We want to educate people on intervention methods that could also help their loved ones. And we want to provide information to facilitate where they can have a connection to reduction services. The three main audiences we are focused on are teens, young adults.
We're also trying to communicate with parents of teenagers and young adults to help communicate that. And then we're also trying to communicate with persons that are current users around Travis County.
Thank you. So the next steps, we had a kickoff meeting, I think it's been about a month ago or so, with a lot of our partners. This included nonprofits, the district attorney, APH, Travis County, Integral Care, and many others. We took a lot of feedback to develop what we call a campaign brief, to kind of map out goals, objectives, target audiences. And we are now taking that, working with our consultant Belmont, to come up with some campaign concepts and message themes. And we will then go back with our partners next week to review those. And ultimately, we hope to have this initiative prepared and ready to launch in November, which I'm thinking about that now, that's only 2 weeks away. But hopefully sometime in November, maybe not November 1st. But our goal is to develop the initiative. Central Health, we're doing that with our partners. But it'll be essentially a campaign in a box that anyone can take and then use and implement however they see fit. Travis County and APH are going to be kicking in some media dollars for paid advertising, but this isn't just an advertising campaign. This has to be a comprehensive initiative, boots on the ground, outreach, flyers, posters, handouts, signage in clinics. So it is very comprehensive, and we know that one social media ad is not going to solve this crisis, but our goal is to bring everybody together so we have a unified message, so we can hopefully save lives. As the Travis County District Attorney reminded us, ultimate goal is to prevent deaths, and so that's what we're working on. If you have any questions, we're happy to answer them.
Do any managers? Yes. Well, let's start with Manager Musaid. Oh, okay, we'll start with Manager Jones.
No, I just have a quick one. You mentioned the governmental agencies, the city, the county, the district attorney. How about the ISDs? Are they part and parcel of this, or are they?
They're not. Well, they will be part of it because we hope this campaign can be adopted and used by anyone. But they are not part of the development of the campaign.
Given the high rates of particularly fentanyl overdoses here in this area recently, should we not bring them in a little earlier, do you think, or is there?
Yes, I think the answer would be yes. For the development, we're relying on our partners at Travis County and Austin Public Health to kind of share it with their stakeholders and their partners so that we can keep the development team a little bit smaller, but so I can follow up with you and let you know who they've reached out to, who they've contacted. A lot of the data that we've looked at, some of it came from the Travis County Medical Examiner's Office. Starting with one of the first things we looked at is who's dying. And it's not a simple solution because a lot of folks are impacted by this. Young people, but also surprisingly, people who were not young. I hate to say older because I might be talking about myself, but people in their 50s or 60s are also dying from opioid overdoses. So it's a really broad spectrum. And I have to tell you, it's been a challenge to even narrow it down to even 3 audiences because there are so many different components to this. People experiencing homelessness are also a target audience. And so relying on some of our nonprofit partners, patient-serving advocacy groups to provide input, but also then to hopefully take the materials and develop materials on their own. We don't have the capacity at Central Health to develop and fund and pay for the entire campaign, so we are relying on our partners to be in collaboration with us to do that.
I would like to add to that one of our partners is Integral Care, and they are representing the ISDs as we go through this development, and they will work closely with the schools.
We have a list of, and I can provide that to you, of all of the partners that we've considered that we know we're going to have to reach out to. And like we did with Let's Stick Together, when we think we're ready to actually show off, to show some of the concepts, we can bring a much larger group together to get feedback and input, that sort of thing, which is exactly the model that we used for Let's Stick Together. Thank you.
And Manager Musaid.
Thank you. Thank you so much for this work. This is personal, and it hits home to me. I recently lost a loved one because of this, and it hurts knowing that it's a silent disease and it's really embedded in our world, and it doesn't discriminate against the color or ethnicity or background. And I asked for this messaging to be in multiple languages because it really affects and impacts many people. And I know within my community, it's happening. It's killing kids, it's breaking homes, and it's ruining lives, and all across different communities. So that is something that we should be mindful of in terms of who it impacts. On another note, I'm part of the Eames ISD Shack. I chair that committee, and now they have a massive campaign, and they've actually also included Arcane at every school as well. So they're doing their parts in educating the youngsters about this evil. I can't find a good word to describe this pandemic. I'll accept that it's ruining lives, and thank you for what you do. Appreciate it.
Well, thank you very much for presenting to us. This is a very optimistic. Thank you again for this very optimistic presentation, and we're thrilled. Thank you.
I would just like to say that I echo Manager Jones's concerns about working with the schools at all levels. And with integral care, which is the old MHMR, my daughter's been a part of that system, for 30 years. The kids in the school system are part of that, okay? Medicaid waiver, blah, blah, blah. Those that are receiving services for medical or behavioral or mental health issues. We also have many chronically ill and medically complex students within AISD. And we also have some failed systems that are pushing kids out. And that's what they find on the streets. That's where they go to when they don't have a family member at home to communicate with. So I'd like to make sure that you do reach out to them, because every effort that we take, every effort should be a joint comprehensive systems partnership with regardless of what it is, okay? And something such as opioid abuse, that was put on to us by the system, okay? It was put on to us, it was forced upon us by an irresponsible governmental, legislative, and congressional lobbying effort for corporations to make money. And so anyway, just please do that. And I thank y'all for your presentation.
Thank you.
Chair,
Yes.
if I may, and the sentiments expressed by Managers Valadez and Jones, we will certainly convey those to the larger institutional leaders that are leading this. I mean, this creative team has built a reputation for itself around town and was tapped to come up with something that's pretty phenomenal. But as Ted alluded to earlier, there's other governmental entities that we need to make sure that are engaging with the school districts and the parent support specialists and other health officials within those school districts and parent groups. And we'll just have to figure out just exactly what that looks like, but we'll certainly convey these sentiments. Thank you.
Well, the only reason I'm saying that with additional emphasis is because I sat on the DAC and I sat on the CCAC, which is the Special Education Citizens Advisory Committee, and I sat on all those various committees. And I can tell you that half the time, the school administrators who were put in charge of those specific projects or efforts, many times didn't have the hands-on connections with the families and the students. And there have been, just like we talked about our dysfunctional system in healthcare, they have somewhat of a dysfunctional system when it comes down to the students that are part of the old MHMR and integral care and special education department. And also the inability to provide student-focused learning. So,
I also don't want to downplay the relationships that we have with the school districts. And as you know, we work very closely with them, our outreach and engagement teams, with parent support specialists.
oh, yeah.
You know, the Hornsby Bend, Del Valley, Colony Park, those efforts would not be possible if it weren't for our partnerships with the schools. So I don't want to downplay or discount the value of those relationships and what we are building and continuing to build.
Thank you so much. And there was no motion necessary for
No.
this.
We'll
So-
come back to you with
More.
the concepts when we're ready to show them.
Very exciting.
Thank you.
And don't forget about the jail. Because,
Yeah.
because I can put up a lot of posters at the jail.
Okay.
Thank you.
Yes. Okay, and then number 4, receive and discuss a presentation on Central Health real estate strategy to support the board-adopted healthcare equity plan and future needs. Stephanie McDonald will be presenting.
Chair, vote 4 and 5 for closed session.
Oh, for a closed session, I'm so sorry. Okay, I apologize. I announce that the board is convening in closed session to discuss agenda number 4 under Texas Government Code 551.072, deliberation regarding real property, and agenda item 5 under Texas Government Code 551.071, consultation with attorney. Okay, so item number 5, receive and discuss updates on the 1115 Medicaid waiver delivery system reform incentive payment, the DSRIP program and associated projects, the Community Care Collaborative and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas, and the University of Texas at Austin. And Monica Crowley will be presenting.
The time.
All right, and so we are going into closed session now, and it is 2:07 p.m.
Hello, everyone. We are coming out of closed session and we'll be back to the public meeting here in just a couple of minutes.
Sound check, Marilyn, can you hear us?
Yes, I can hear you.
Go ahead and try that one more time, if you could. Sound check, Marilyn, can you hear us?
Yes, I can hear. Can you hear me?
So we are back in open session and it is October 12th, 2022, and the time is 3:12 p.m. So confirm the next strategic planning committee meeting date, time, and location. Managers, our next Central Health Strategic Planning Committee meeting is tentatively scheduled on Wednesday, November the 9th, 2022 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I am ready to accept a motion for adjournment.
So
Thank you, Dr. Bell. In a second.
Just one last thing. Did you mention
Oh, yes, and yes. The closed session, no action was taken. Okay, and so we have Dr. Bell and manager was to as a second.
Yes.
And yes, and Oliver.
Yes.
Yes.
All right.
Thank you.
All right.